be trapping.
My name is Impasoli Power, and today I have joined by a guest who will give us more insights about tuberculosis. So he will introduce himself.
Yeah, I'm Wesley Pava from the land.
Okay, let's talk about tuberculosis. What is tuberculosis?
Tuberculosis is caused by bacteria called mycobacteria. The bacteria or germs usually attack the lung. TB germs can attack any part of the body, such as the kidney, the spleen, or brain.
Okay, how is TB spread?
Okay. TB is spread through the air from one person to another. The TB germs are spread into the air when a person with are infected. TB disease of the lung or throat cough, speaks or sing. People nearby may breathe in these TB germs and become infected. When a person breathes in TB germs, the TB germs can settle in the lung and begin to grow. From there, the TB germs can move through the blood to one part of the body, such as the kidney, spleen, or brain.
Okay, who is at risk for getting TB?
Anyone can get TB. Some people have a higher risk of getting infected with TB. People who have contact with someone who has infected TB disease. Secondly, persons who were born in or who frequently travel to countries where TB disease is common, including Mexico, the Philippines, Vietnam, India, China, Haiti, Guatemala, and other countries with a high rate of TB. Thirdly, health can work and others who work or live in places at high for TB transmission, such as homeless, shelter, jail, and nursing homes.
Okay, so what is latent TB infection?
In most people who breathe in TB germs and become infected, the body is to fight the TB germs to stop them from growing. The TB germs become inactive, but when remain alive in the body and can become active later, this is called latent TB infection, or RTB for short. So, people with TB have following points: have no symptom, don't feel sick, can't spread TB germs to others, with usually have a positive TB blood test or positive TB skin test reaction, may develop TB disease if do not receive treated for TB. People with TB do not have symptoms and they cannot spread TB germs to others. However, if germs become active in the body and multiply, the person will go from treated to prevented them from developing TB disease. Treatment of TB is essential to controlling TB in the United States because it substantially reduces the risk of TB will progress to TB disease.
Okay, you have talked about TB disease. So, what is TB disease?
Okay, if the immune system can't stop TB germs from growing, the TB germs begin to multiply in the body and they cause TB disease. The TB germs attack the body and this occurs in the lung. The TB germs can create a hole in the lung. Some people develop TB disease soon after becoming infected within weeks. Before their immune system can't to fight the TB germs. Other people have recurrent TB infection and may get sick years later. When their immune system become weak for another reason, treating late TB infection is effective and is prevented TB disease. People with TB in the lung front can be infections, meaning that they can pass TB germs to their family, friends, and others around them. People with TB in our part of the bodies, such as the kidney, spleen, are usually not infections. People with TB are most likely to spread TB germs to people. They spread time with every day. This includes family members, friends, co-workers, school or schoolmates. People with TB need to take several medicine when they start treatment. After taking the TB medicine for several weeks, a doctor will be able to tell TB patients when they are no longer able to spread TB germs to others. Most people with TB disease will need to take TB medicine at least 6 months to be cured.
Okay, so who is at risk for TB disease?
Many people who have affected with TB never develop TB disease. Meanwhile, not everyone with TB will develop TB disease. About 5 to 10% will develop TB disease over their lifetimes. If not treated, progression from the untreated TB are estimated to account for approximately 80% of US TB cases. Some people who have TB are more likely to develop TB disease than other. People at high risk for developing TB disease generally fall into two categories. One category, those who have been recently infected with TB germ. Secondly, those with a medical condition that weaken the immune system, including HIV infection. Substance use, such as in injection and drug use, and we have specialized treatment for rehabilitate disease. We have organ transplant, organ transplant, severe kidney disease, head and neck cancer, diabetes, medical treatment such as control and silicones and low body weight. Children, especially those under 5 age, have higher risk of developing TB disease once infected.
Okay, what are the symptoms of TB disease?
Symptoms of the TB disease are depending on where the body TB germs are going. TB disease in the lung may cause the following symptoms. First, cough lasts longer than 3 weeks. Secondly, coughing up blood or neptum inside the lung. Thirdly, chest pain. Fourth, fever. Fifthly, we have night sweat. Sixth, we have feelings. We have loss of appetite, weakness or fatigue, lose the weight. Symptoms of TB disease in other parts of the body may include the following. TB of the kidney may cause blood in the urine. TB meaningless may cause headache or confusion. TB of the spleen may cause back pain. TB of the thorax may cause hoarseness. For information on how TB is treated, that's it.
Okay, so should I get tested for TB?
You should get tested for TB if, point number 1, you have spent time with a person known or thought to have affected TB disease. Secondly, you were born in or frequently travel to country where TB disease is common, including Mexico, Philippines, Vietnam, India, China, Haiti, and mention a few. You currently live or used to live or are employed in the large group setting where TB is the most common, such as homeless, shelter, prison, jail, and nursing home. You are health care worker who care for patients with TB disease. you are the part of a population that is the most likely to have a latest TB infection or TB disease, including people who don't have good access to health care, have low income, or misusing drugs or alcohol. Yeah, in addition, children, especially those under 5, have high risk of developing TB disease once infected. Therefore, testing for TB infection in children who may have been exposed to a person with TB is important.